Any further delay, let's begin today's event. Why Physician Quality is the next tool in your benefits toolbox. Sponsored by Grand Rounds, hosted by Employee Benefit News. I would like to introduce your moderator for today, and that is Elliot Cass. Elliot, you now have the floor.
Thanks, Christina, and hi, everyone, and welcome to today's webcast on redefining employee health care. This event is brought to you by Employee Benefit News and sponsored by Grand Rounds. I'm Elliot Cass, and I'll be your moderator. Balancing the best interests of employees with the best interests of the business has become increasingly challenging for benefits professionals tasked with keeping their healthcare spend in check. Benefits tools designed to reduce employer costs, such as narrow networks, exclusive provider organizations, and high-deductible health plans, often do so by passing those costs along to employees. Today we'll learn how a network focus on physician quality can reduce your healthcare costs while actually increasing employee satisfaction. Our experts will discuss how early diagnosis and expert treatment of potentially high-cost claims can mitigate your risk exposure. Joining us is Hassan Azar, Senior Vice President for Total Rewards at U.S. Foods, where he oversees compensation and benefits for the company's 25,000 employees. Hassan is responsible for the company's employee rewards strategy, including program design, administration, and financing. Previously, he worked for Mondelez International, where he was Senior Director of Global Rewards, at Kraft Foods as Director of Global Benefits, and at Delphi Automotive as the Director of Global Compensation and Benefits. Hassan also worked as a senior healthcare consultant with Towers Perrin in Boston and serves as an advisor and board member for a number of healthcare and benefits startups and foundations. He has a master's degree in business administration, a master's in health services administration, and a Bachelor of Arts from the University of Michigan, as well as a Juris Doctor degree from the University of Detroit School of Law. Great to have you here with us today, Hassan.
Thank you, Elliot. I'm very happy to be here talking about something near and dear to me, and I think it's a great topic to share with benefits leaders across the country.
Joining Hassan is Donna Sexton, Director of Employee Benefits at Costco Wholesale. Donna is responsible for program selection, supplier collaboration, implementation, and all aspects of operations that make the Costco Employee Benefit Program one of the best regarded employer benefit programs in the U.S. Donna began working with the Price Club in 1984 as a cashier in San Marcos, California. After holding a number of positions in the warehouse, she moved to the company's headquarters in San Diego to work on special projects. Following the Price Club and Costco merger in 1993, Donna transferred to the Seattle area and began a 20-plus year run with employee benefits. In addition to her role at Costco, Donna is currently on the board of trustees for the Council on Employee Benefits. So glad you could join us today, Donna.
Thanks. I'm glad to be here.
And rounding out our panel of experts is Dan Kimball, who heads enterprise marketing at Grand Rounds. Dan is a veteran enterprise marketer, having built marketing organizations at growth stage companies as well as established market leaders. He joins Grand Rounds from This Moment, a marketing technology company where he was the chief marketing officer. Dan also held leadership positions at Upsite, a business intelligence company, and CoStar Group, a commercial real estate research organization. Dan attended Colgate University, where he earned his BA. Welcome, Dan, and thank you for being here.
Thanks for having me.
I'd just like to remind everyone that Hassan, Donna, and Dan will respond directly to your questions later on in the webcast. If you have a question, please submit it by typing it into the question field and then clicking Submit. We really encourage everyone to do this, and we'll answer as many of your questions as time permits. And now, without further ado, let me turn things over to Dan Kimball. Dan?
Thank you very much, Elliot, for that warm introduction. So let me first tell you all a little bit about Grand Rounds. I'll talk for a little bit, and then Hassan is going to tell us more about his philosophy with regards to physician quality as a measurement tool and as a way to guide employees to the best possible outcomes. And then Donna will share her stories, and then as Elliot said, we will be happy to take your questions. Very briefly about Grand Rounds. Grand Rounds, our promise to employers is that we help employees and your business to achieve measurably better outcomes. So what do I mean by that? With Grand Rounds, patients get personalized and comprehensive guidance for whatever medical need they have. By providing your employees with access to the highest quality of clinical care at critical stages of the medical journey, they become smarter, which we've seen time and time again. They become more confident, and they also derive better healthcare outcomes. And at the end of the day, they get back to work faster, they live happier, healthier lives, and for those of you who are self-insured in the audience, you recognize great cost savings when you avoid unnecessary procedures and treatment paths that are led by unqualified physicians. So some of the primary problems that we solve as a business are, A, poor healthcare decision-making is causing wasteful healthcare spending, like I just talked about. Care choices are misguided. It's leading to just wasted opportunity and wasted treatment paths. And this issue was compounded for groups that recently moved over to consumer-driven health plans where employees now had to make more healthcare choices but didn't have the tools to do so in a smart manner. So this is a really big problem that poor healthcare literacy it's just leaving people kind of hanging out to dry with regards to finding the right physician, getting the right procedures done, and just making bad decisions because they're not getting proper guidance. Number two, low-quality care is leading to bad health outcomes and more time out of work. So folks are seeing too many doctors, they're going to doctors that are in the wrong specialty type or don't have the right procedural expertise, and at the end of the day, there's bad outcomes. Some of our customers, some of our larger customers claim that upwards of 30 to 40% of their healthcare spend could be avoided if their employees receive the proper advice and the proper treatment guidance from the right physicians at the right time. And the last problem we solve is that programs promising ROI, return on investment, and improved outcomes just haven't been delivering results. There's just been an imbalance in a lot of the programs that have been implemented over the last 5 to 10 years by benefits leaders. I think we all know what those are, but at the end of the day, it's putting a lot of the burden and cost back on the shoulders of employees. And although these programs in the near term are driving down the healthcare trend, it's leading to really just unsatisfied members of the population, and it's unsustainable in the face of retention and in the face of doing right by your employees. So I'm going to turn it back over to Elliot, who's going to give you all a little poll, and I'm interested to see the results so we can continue this talk.
Thanks, Dan. And yes, we're going to take a moment now to poll our audience and get a sense of their views regarding physician quality. Everyone should see the question in the center of their screens. I'm going to go ahead and read it. What is the average length of time it takes for new medical research to make its way from authorship to 100% of the medical community in the U.S.? And we're giving you 4 options here. Choose the one, obviously, that you think is the most accurate response to the question. You can choose 1 year, that's option 1, 5 years, that's option 2, 12 years, that's option 3, and 17 years, that's option 4. So again, quickly, what is the average length of time it takes for new medical research to make its way from authorship to 100% of the medical community in the U.S.? And your choices are either 1 year, 5 years, 12 years, or 17 years. And with that, we're going to close out the poll and wait just a moment here for our system to tabulate the results, and let's see what you all thought. Okay, overwhelmingly, almost 60% of you, just shy of 60%, believe that it takes 12 years for this process to take place. Those of you that thought it takes a year, versus those of you that thought it takes 17 years. We're more or less split at about 20% each, and nobody, not a one of you, 5 years and 17 years, not a one of you thought that it takes only 1 year to disseminate. And with that, I'm going to turn things back over to Dan, who I'm sure is going to enlighten us as to what the truth of the situation is. Dan?
All right, Elliot, it's almost like you had the script here. I am going to tell them the answer. The answer is D, 17 years. So the average amount of time it takes from a research report being authored by a physician in one place and it actually reaching 100% of the medical community, so other doctors in the field or another field can use those treatment paths that have been discovered and leverage a lot of the modern way of thinking that some of the more innovative doctors are doing, is 17 years. So that's 1999. There are doctors out there today that are dependent on research reports and medicinal practices that were authored back in 1999. That is scary because in 1999, I think what I was doing at this moment was downloading my 50 free hours of AOL dial-up internet and buying my first mobile phone. That is a really long time ago, and in the world of medicine, that is insane. I would hate to be the person that's exposed to the kinds of treatment paths and medicinal knowledge of the physicians who are dependent on that kind of research. That is one of the core problems. That is one of the roots of the problem that we're here to talk about today. It's not just that there's outdated research and that it takes a long time for research to make its way from one place to another. That is certainly core. But at the end of the day, what we're here to talk about is physician quality in general and the harmful effects in terms of outcomes and costs of poor physician quality on employee populations. One of those attributes that we look at is, are they up to speed on their medical research and are they practicing modern medicine? There are many other factors that we look at that we'll talk about as well. What you're looking at on your screen right now is a map of the United States that has dots all over it. Each dot is representative of physician quality in each hospital service area across the country. Okay, so each dot is a hospital service area, and the color of the dots is representative of the quality, the average physician quality of physicians in that hospital service area. The green dots mean that that area of the country has a really high average physician quality. The red dots means it's really, really, really bad quality, like you wouldn't send your worst enemy to these physicians. Anything in the middle, like the oranges and yellows, which is what predominantly occurs across the hospital service areas in the United States, represent average physician quality, meaning not the best, okay? So what we're looking at is a map of the United States that demonstrates that overall we have poor to average physician quality when you look at an entire, this is one carrier provider network. And what it tells us is that when left to their own devices, any consumer out there, whether it's me or you or an employee of yours that lives in some part of the country, either in a major metro area or in some remote area, when left to their own devices, they will likely choose a poor or average quality physician if they're using regular means of finding a doctor, like asking a friend or going to Google or going to the carrier provider website. Okay? That's what we're looking at. That's the big problem. Now, the root cause of that isn't the fact that high-quality physicians don't exist. They do, in fact, exist, and they exist in just about every hospital service area across the country. What you're looking at here is a lot of green dots. The green dots represent high-quality physicians. This is what happens when you overlay the Grand Rounds quality algorithm on top of that quality map. And we look at that average quality improve greatly when we start to weed out those that we don't endorse and that have things in their past and don't have the experience and don't have the clinical expertise. There are great physicians just about everywhere in the country. So at the end of the day, this isn't so much a supply issue, it's a patient knowledge issue, and it's the ability for consumers to find the most appropriate level of care for their need is really difficult when they're being misguided. So that's a good thing. The other good thing is that when you start to drive your employees to higher quality physicians, the outcomes are clearly better. Patients receive 15% lower hospital readmission rates, 20 to 25% lower complication rates, 30 to 40% lower mortality rates, and an average of 10 to 30% lower cost per patient when people see good physicians versus bad physicians. Now, to further compound the issue, as if we needed to, there's a high level of variance even within the hospitals, within these really great hospital service areas. And so what you're looking at here is within the San Francisco Bay Area, we've got 4 very well-regarded hospitals, UCSF, Stanford, Sutter Health, and California Vascular Care. Each dot within each of these hospitals represents an individual physician. In this case, we evaluated the quality of cardiothoracic surgeons within each of these hospitals. Now, if you were to ask a friend or go to a provider website or even potentially ask your PCP for a referral, they might say, go to Stanford. You've got to see a cardiothoracic surgeon. Go to Stanford. You'll be set. They've got a great practice there. They're world-renowned. But even within Stanford, one of the foremost hospitals in the world, there are really good physicians represented by the green dots, and then there are average and low-quality physicians as well within the cardiothoracic department. So this is a problem for 2 reasons. Number one, most of the recommendations that your employees are getting with regards to the physician or the specialist to see from friends and other sources are associated with the hospitals and not the doctors themselves. Go to Stanford, they're great. Number 2, the carriers can't, and won't discriminate between individual practitioners and the provider systems within their networks. It's just not how they're motivated, and it's not what they're offering to employees. That's also a problem because you only get provider-level quality and not physician-level quality. So the average consumer is virtually blind to these nuances with today's most commonly used tools in the market. And that's a problem because, as I talked about before, the outcomes are stunning when you think about the differences that happen when you see a high-quality physician and a low-quality physician. This chart shows 3 different comparative outcomes for patients who see adult reconstructive surgeons. This is for high-performing adult reconstructive surgeons versus average performing. The 30-day rate of readmissions, there are 22% fewer readmissions after knee or hip replacements versus the average quality. So the good physicians get 22% fewer readmissions. High-quality physicians see 36% lower rate of joint infection or device problems than average quality physicians. And higher quality physicians see 37% lower rate of blood clot formations than average quality physicians. Now, this is a comparison between high quality physicians and average quality physicians, not even the poor quality physicians. So it's really important from our perspective, and as you'll hear from Hassan and Donna, that you are driving your employees to the highest quality physicians who can provide the most appropriate level of care possible. Very briefly, the reason we know all of this is because we have a lot of people at Grand Rounds who are picking apart data from a lot of different places that has recently become available to us. And we're building an understanding of physician quality. We've identified hundreds of different attributes that we use to measure physician quality across 96% of the physicians in the United States, across 3 primary pillars. Number 1, clinical judgment. We ask, will this physician make the right diagnosis and treatment recommendations? Right? Seems like a fairly simple question, not the easiest one to answer, but we do it by assessing utilization rates, process measures, and background factors of physicians. We look at procedural skill of all the physicians. So we ask, if surgery is appropriate, will this physician perform the procedure successfully? And we look at clinical outcome data, volume of experience, and other background factors to determine procedural skill. And then lastly, communication skill. Will this physician earn a patient's trust and convince them to follow the right treatment path? Because as we all know, if you don't like your doctor, adherence isn't so good. And that's based on patient satisfaction and adherence rates, among other factors. So very simply put, if you look at physician quality across these factors, and you look at the hundreds of attributes underneath each, you can get a fairly objective view of physician quality across the U.S., and that's the basis for our understanding at Grand Rounds. Very briefly, at Grand Rounds, our primary product is called Grand Rounds Beacon. We use our physician quality data to fuel the different products that we offer. We offer three different parts of Grand Round Beacon. The first is remote care. That includes expert medical opinions from world-renowned experts. Talk to a doctor, which is the ability to connect with a Grand Round staff physician when you need to discuss treatment options. And in-hospital treatment decision support, where you can connect with a physician if you're in the hospital and you're not certain that you're getting the right stuff done and you want an opinion from a staff physician. Number two, in-person care. This is all about matching patients with the most appropriate physicians for their needs and providing them with a staff physician-led care coordination to make sure that the appointment is booked properly, they take your insurance, you have all the proper questions that you're prepared to ask when you go to the doctor, and at the end of the day, you're seeing the right physician who is the most appropriate for your needs. And then there's a whole host of supporting services that we offer, from records collection to staff physician-led care coordination and long-term follow-up for each and every patient. And the last slide is the impact. So at the end of the day, our goal is to drive primarily better outcomes for employees and subsequently value for all of you who are running benefits programs and are looking for ways to trim your healthcare trend, but in a way where you're not impacting negatively your employee populations. So the immediate measurable impact that we see is $8,900 saved per expert opinion case, $1,800 saved per office visit case. We see up to a 10x increase in utilization over legacy vendors in the space who have been doing this a long time. We have new methods of doing this that make this more efficient and drive much higher levels of engagement, and an average of 3-to-1 return on investment for our programs across our book of business for our customers. So I'm happy to take questions afterwards about our products or about the ways in which we measure physician quality, but I'd love to turn it over to Hassan, who will talk about how he puts some of this into practice and the way that he thinks about physician quality as a driving force for his benefits program. Hassan?
Thank you, Dan. So I want to start by just talking about exactly how employee health fits into a corporate strategy and why we should actually care about it as benefits professionals. I'm sure that I'm sure that, like myself, many of you are either working on a strategy, you're impacted by a strategy, you're changing one, or you're aligning one. So I just want to say that regardless of where you are in the spectrum of corporate and HR strategy development, you need one key element to make sure that all of them work. And as I show at the top line there, healthy employees really are the backbone of a company. You can make all the strategies that you can dream of and plan, but if you don't have healthy, productive employees actually doing the work, a lot of those strategies aren't going to get you anywhere. Healthy employees are essential to corporate performance. The company's benefit strategy has a significant impact on the human capital strategy and being a key driver in the overall business strategy. So while I show in the picture that it's a top-down approach where the corporate strategy drives an HR strategy, which then helps turn it into a benefit strategy, Actually, I could show data that goes the other way, that the benefit strategy actually impacts the people strategy and then the company overall, so that the success of the company is very driven by how robust your benefit plans are. And specifically, I'll talk about the kind of medical management and the medical programs that you have installed at your company. So while your finance team down the hall from you may think that your benefit plans are just an expense for the company, costing money, you're actually in a unique position right now to drive corporate performance by improving employee health, increasing productivity, increasing engagement and retention. And all these things are going to help improve the company's success. So let's talk about where your benefit plans are heading and how to get there. So companies with the most effective benefit plans have demonstrated that it's necessary to design and manage programs with just the same rigor that you would if you were building a new factory or designing a new product. So in part of those sound management principles for benefit plans, we all need to make sure that our benefit plans, especially our medical plans, are aligned with the business goal, that they're helping the company thrive, that they're actually improving health and that you're measuring it, that they're well communicated, that they're managed and administrated as efficiently and effectively as possible. And just as important and ultimately, that they're useful and valued by employees. So then I ask the question, so what kind of programs are valuable to employees? Is it the cheapest benefit plan you can offer, the easiest? Well, no, I actually hold that it's the programs that actually work to improve health and get employees and their families to live a healthier life. So therefore, by helping employees gain access to high-quality physicians like Dan mentioned and Grand Rounds is doing, helping them take control of their treatment plans and gaining control over their medical care, you can actually give something that employees need and will value and will ultimately help the company in its performance. So I think it's important to determine what do you want your healthcare programs to do. It should be more than just offering what the benchmark tells you. You don't want to design a program just because a consultant said this is what your competitors are doing or this is what your next door neighbor is doing. You want to give something that's the best that healthcare employees need and want, and that you have a duty to provide to them. You open the business section of the newspaper these days, and you'll see examples of the scrutiny that Wall Street places on financial performance. Your CFO and your CHRO are expecting you to deliver effective programs that make a difference. So how are we going to do that? We know that numerous studies have shown the correlation between a highly effective health and wellness program and corporate financial results. So while it's vital that your healthcare programs are cost-efficient and cost-effective and valued by employees, you actually want them improving health, controlling healthcare costs, and improving the lives of employees. So how are you going to make sure that your medical plan is going in the right direction? As you've heard time and again, successful management of your healthcare plans includes managing your vendors, making sure that your vendors are aligned with you and they want the same things and they're trying to drive the key performance indicators that will actually help your company, offering programs designed to drive results, and promoting individual responsibility and management of your employees' health. I think it's possible to do this even greater today, your greater success and chance of doing this by driving engagement programs, well-crafted incentives, communications, having the right culture in place, and again, by looking at tools such as Grand Rounds as introduced here. And it's just as difficult as designing and funding a medical plan is these days. I would say getting employees to take action and pay attention to your programs is just as important. So while inspired and healthy employees help drive company results, after you've designed a great program, your work is only beginning. You have to communicate it. So managing medical plans is not easy, and using them these days seems to be more and more complicated. We hear more and more stories from our employees about how difficult it is to use a medical plan, get access to care, find the right physician, and find a treatment that will take care of them or their family members. And if your employees are turned off or confused, they will give up and probably not participate in managing their own health. So it's important that we communicate well, give them guidance, direction, and the support that they need. Our employees, all of us, need need help making decisions so we can make the best use of the benefit plans that we've spent so much time and money putting together. Just quickly talking about tools and kind of the heading for this program today is talking about a tool in the toolbox. As benefit leaders, we've talked about our tools for a long time, since I've been doing benefits, almost 20 years now. The tools in our toolbox change often. We get shiny new tools that come along. But one that's constantly been an effective tool that I've seen is decision support and guidance for employees. It's one of the best things that you can offer employees, and it's probably not used as much as it should be. It's exciting now that these tools and programs help our employees, and they're actually getting sharper and better and easier to use, most importantly. It's not just about giving your participants more information, more recent information, or even faster access to information. It's just as important and probably ultimately important to deliver medical treatment that is customized to them, leading them to the most appropriate treatment plan and a provider who will give them the best care possible. So just to wrap up in talking about strategy and provider quality, I'm going back to where I started, and I modified the picture a little bit to talk about how provider quality and medical care actually impacts everything that the company does these days. Your medical plan actually can impact corporate performance more than we want to admit sometimes. Your medical plans depend on the quality providers that your employees see today, tomorrow, whenever, and wherever they are across the country. Your employees are actually impacted by the quality of the care that they see. As we've heard, often in kind of a cheeky manner, not every physician graduated first in their class, and the effectiveness of the treatment plan that your employees are in and their ability to seek care from the best expert possible is going to help drive company performance and control your costs. Managing medical plans is not actually a set-it-and-forget-it exercise anymore. Your employees need help navigating the medical system, and as more of us go to high-deductible health plans and putting more responsibility in our employees' hands, we actually owe it to them to help deliver access to high-quality physicians and give them the tools such as what Grand Rounds has to offer. You can ensure that your programs are actually adding value and driving performance by looking at who is caring for your employees, guiding them to better care, and helping them achieve better health outcomes. So with that, I'm going to turn it over to Donna now to talk about how she's used Grand Rounds at Costco. Donna?
Sure, thanks, Hassan. I will do my best to go very briefly so we have time for questions and answers. And really quickly, oh, there we go. I was clicking the wrong thing to do the slides. Hopefully everybody on the phone knows who Costco is. This is just a quick slide about about some of the things about our company. And, you know, one of the things that is really important to recognize, these programs are successful for us because of the fact that we've got so many folks in our benefit plan and our turnover is strikingly low. We have a very strong philosophy around our merchandise and how we take care of our members, as well as applying that same type of philosophy to our employees. We have a strong family atmosphere at Costco. We pride ourselves on offering good jobs, paying good wages, having good benefits, and we know if we do all those things, only good things happen. We started looking at second opinion and physician referral services about 3 years ago. We, like many of you, were probably noticing a high spend in orthopedics. We were having, a huge amount of oncology cases, neurology cases, cardiology cases. We knew that there were a lot of unnecessary surgeries happening, and our folks were sometimes going out of network, and those out of network encounters were extremely expensive. So two of the things that we decided to do was bring in somebody to help us on expert opinions and physician referral. And in addition, we removed our out-of-network benefit. So we are at an EPO situation, which I know Elliot mentioned in the beginning as being a little bit tenuous on the employees. It could push more cost to them. but our benefit plan is so rich, and our networks, we feel, are very widespread enough to get people what they need that we weren't too afraid to do that. Another thing to be said, we are not in the high-deductible health plan offering and don't see us ever going to it. So some of the reasons that we chose Grand Rounds was we could see from the information that what they were focused on was driving opinions and utilizations, and especially in key areas. I mean, we don't need to mess with some things, but the bigger spend items, we thought it was really important to put a focus on that. We totally got excited about how they were looking at quality, how they were deriving that from their complex proprietary algorithm, as they would call it, that really does a deep dive into the things that make up a true quality encounter. We have never presented this to our employees as a cost-saving device. We have presented it only as in quality and value. We were excited about the infrastructure they set up, the record specialist, the staff physician, and a care coordinator, pulling in all those pieces and taking the work off of the employee at a time when employees, could be very confused and not know how to navigate whatever situation they had found themselves or their family member in. A lot of you have probably seen this type of information before, but it's pretty standard out there that we can say that 60% of the time, day in and day out, we're all going to recognize a potential change in diagnosis or treatment. And we have been with Grand Rounds now approaching 2 years, and we are tracking exactly at those numbers. We are seeing surgeries canceled or switched to a less invasive option. And our employees appreciate that. If you can get to a less invasive option, as any of you would know, we get back to work faster. We're able to. It's less burden on our families, and just all good things happen. We can always go back to surgery if that's what's needed. So what we've learned early on is that having these expert opinions is definitely the initial bait that we put out there for the employees, for lack of a better term. But what we're seeing that's more beneficial and more critical is what happens before and after these surgical interventions. We're able to have somebody come back and take a really good look at, am I even getting the right treatment? Is surgery really the option? So we've had a couple of really fascinating cases, and this one that's on display right now is a gentleman who, for over 2 years was so ill and so sick and was seeing a lot of providers, trying to look for a reason. They had amassed over $300,000 in healthcare spend, to Costco. His wife, who is our employee, was just at her wit's end. She really thought she was going to be losing her best friend, and there was you can imagine the concerns. So, with Grand Rounds, they opened up a case. And in less than a couple of hours, once they matched him up with a local allergy expert, within a couple of hours they find out that it's an allergy to one of his medications. And the change in their lives was, dramatic. Too bad for us, we already spent $300,000, but at least we're not going to spend another $300,000. So, what we started thinking about was, well, what if they get to the right doctor the first time? What if it isn't the expert opinions that we need so much as making sure our employees are seeing high-quality doctors from the beginning? We're going to do a little video that tells another story, and it really writes home to what we're all looking for here.
Kevin, Brenda, how's it going? It was July 8th, and I walked into my building, and I was completely disoriented. I had difficulty understanding where I was and what I was doing. I progressively was worse. When I would deal with the doctors, I feel like I was one in 1,000, and I was. And that's when I contacted Grand Rounds.
When people have a medical problem, regardless of how serious it may be, they've got questions and they're scared. It's never an easy time, and they're coming to us because they want answers. Grand Rounds is different from every other health benefit out there. Our goal at Grand Rounds is to make sure that no patient feels that they're alone in this. We want them to know that they've got a team who is supporting them, from a care coordinator who is with them all the way to make sure their questions are answered, a record specialist who is getting all of their information collected and organized, our staff physicians who are helping them on the medical side of things, and then our experts who are providing them with their personalized opinion.
When I called, my care coordinator was extremely helpful on the phone. I had a battery of tests. I had spinal taps, MRIs, CAT scans, and blood tests. I released that all my information go to Grand Rounds. I received a 13-page report, and it was easy to read. It was so understandable. That gave me something to hold on to. Grand Rounds is really the pivotal point where I saw hope again.
We know that we're answering their questions, and we know that we're going to give them something of substance at the end of it that's going to have an impact on their life.
They told us that overactive thyroid is the #1 leader of autistic children. Right out the gate, we're thinking maybe we have an autistic child. The special endocrinologist that we were seeing decided to have him try different doses of medication, and it wasn't working. We knew we needed a second opinion.
I had such a great experience and suggested that Jordan contact Grand Rounds.
The level of care from Grand Rounds was way more in-depth compared to the specialists we were seeing. Costco provides awesome benefits. Having the opportunity to get a second opinion so fast was just great. And the future looks really good for him.
I don't know where my recovery would be if I hadn't had Grand Rounds at that time.
Donna, you might be muted.
Oh, no, we're not. I don't think we are.
Video ended.
Do you hear me now?
Yes, we can hear you.
Okay, perfect. Sorry about that. So, what we've learned that, is some personalized attention is really helping our employees get more educated and understand their conditions better. And I think that's a huge success. We happen to be meeting today with our Grand Rounds team going over our quarterly results, and there's a couple of cases that struck me as so important to what we're really trying to accomplish. And they aren't these big giant cases that you're saving the $300,000 on. They're truly misdiagnoses and things that are life-changing. So our employees and participants are given a survey after their encounter of how well they understood their condition before they interacted with Grand Rounds and how they understood it after. And this result speaks to itself. I mean, 90% of us are much better able to understand our condition and probably be able to make better decisions, as shown by 84% following the expert's recommendation. So when we saved $45 million the first year that we eliminated the out-of-network benefits. But better than that, we were able to say to our employees, we're doing this because we need to cut the waste out of the system. Just like we cut the waste out of every product that we sell at Costco, We know there's a lot of waste in the healthcare system, and we want to, or are committed to offering rich benefits from here till kingdom come. And to do that, we need to do our part to cut out the waste, and we need to get our employees engaged in doing what they can do. So besides the other great things that happen with Grand Rounds, like collecting your medical records for you, digitizing them so you have them ongoing, those are just icing on the cake to the fact that we're really making a difference in people's lives. So for us, they match our benefits philosophy and our company culture just perfectly. The program, it's a family-friendly program for sure. And then that's what we're out to offer. We are going to continue great benefits like I mentioned, and we have totally understood as a company the value of doing these things for our employees. We know that productivity is increased by reducing the stress, having less time out on leaves of absences and those types of things. But other than that, for anybody on the phone who's a retailer, we also benefit from this high employee satisfaction. Our employees don't steal from us. They treat our customers and members really well. So we understand that while benefit costs may continue to rise, we still understand that there's a huge value to having that for your employees. Again, we never talk about cost. We talk about quality and value. We do that with our merchandise, and we do that with our other programs, although I am frequently reminded that merchandise and people are two different things. It is still a philosophy that crosses both. And this has been simple to implement for us, and our utilization is just continuing to increase. With that being said, I'm sure there are a lot of questions.
Yeah, Donna, you're right. We do have quite a few questions here. So now we're going to turn things over to our audience, so to speak, and give you all an opportunity to answer their questions. And we'll do as many of those as we can in the time remaining. Okay, so let's move to the first question. And it's this: how do you think about physician quality versus physician cost? Which is more important to consider? And maybe you could talk about why.
I'd be glad to take that really quickly. We talked about this even this morning. There are times where an interaction with Grand Rounds is going to result in additional costs, because perhaps the treatment plan is missing some key important piece. So what we just want to stay focused on is our quality and outcomes, and is what a doctor is doing the right treatment for what's happening. I don't know how to say it any other way but that.
Okay, great. Thank you, Donna. And while you're going, I'm going to move to the second question, which is directed at you. The questioner writes, at Costco, is the use of Grand Rounds second opinion mandatory in the plan, and is it incentivized?
Not yet. That's part of our philosophy. I hope there's no Costco employees on the phone, but part of our philosophy is to give our employees tools to do the right thing. And while we'll have a lot of employees that will do the right thing, then we can tell a story to prove out what we're doing. And at that point, we may consider incentives, disincentives, or some mandatory practices. We're exploring those now, but we'll be going slow.
All right, thank you. Pushing ahead to the next question, how would you recommend implementing a program like this when your carriers have their own ideas and their own definitions around quality?
Well, in our case, unfortunately, it's harder to get employees to accept the findings of the carrier, even though the carrier probably deserves more consideration than employees are giving them. I know when we first went to a quality network with our carrier, I was leading the charge and happened to march into my doctor's office and say, I see that you're a quality provider with my health plan. And he basically said, so what? It meant nothing to him at all. So it certainly, didn't jade me because of being in benefits and I knew what they were doing. But I thought if that's what our employees are facing when they're talking to the doctors, we really will, it'll make a lot more sense to bring in a third party that's independent of the carriers and that is also not having to base their decisions on the carrier's contracts with those providers. So to us, we promote it as an independent evaluation into quality.
Okay, great. Thank you, Donna. Here's our next question. I believe it's most likely directed at Dan here. So does Grand Rounds essentially establish the network of physicians? Meaning if the employee doesn't select the Grand Rounds recommended physician, does the employee then pay full cost?
So that is a good question and one that we get often. So the answer is no. The best way to think about us is that we are providing a virtual layer that sits atop your already contracted network through your carrier. So your carrier has already identified a provider network that they've got contracted rates with. What we do is we help you to identify those physicians within that network that are of the highest quality and ensure that your employees are being guided to the most appropriate physicians for their needs. And then it's up to you to determine whether or not you want to use a carrot or stick to get folks to actually follow the program. But that's really as much a cultural decision as anything. But it's not something that we do because it's not our network; it's your network.
Okay, thank you, Dan. We're getting close on time here, but we're going to squeeze in a couple more questions here, and this is the next one. What suggestions might you have for the audience for rolling out new programs like these and taking calculated risks that have big forward-looking upside?
I'm glad to start that. Always executive-level support is really helpful. And there are a couple of things we might have done different given that chance. But what we did do is engage the highest-ranking person at each of our locations to give them to really understand what was available. And that helps them from an operational perspective. I think each of our locations could have between 250 and 700 employees. So these general managers are faced with the people coming to them, looking for them to help them solve their problems, and to be able for them to have in their hip pocket a trusted resource to give an employee made a big difference. And then in our country in our company, you tell two friends, they tell two friends, and it spreads like wildfire.
Okay, great. Thank you, Donna. So you had referenced getting executive support. This next question is kind of a follow-up to that. How do you get your C-suite to think about physician quality?
Well, it wasn't that hard for us in the sense that our company is based on quality and value, so that wasn't, the rub was they also, a lot of these executives sit on various hospital boards or, have donated lots of money to nursing schools or, this kind of stuff. So they think they're pretty in the know on that, and that if the doctor is saying it's so, it's so. So we had to just we have to keep telling them stories about the encounters that our employees or their family members have had. So when we can get testimonials from folks and you continue to share those, there's always somebody in the room that resonates with, and including our high-level executives. We had one at one meeting stop and say, I wish I would have known about something like this when my mother was sick, and I could have done that because, of course, they can pay for it themselves, kind of thing. But because the mother wasn't covered on our plan, but just that being able to equate it back or to relate it back to their own personal situation starts really selling the product.
Okay, thank you. So we are pretty much out of time, but we're going to squeeze in one final question here, and that is, so then from the employee standpoint, how do you get employees motivated to care about physician quality and related issues?
For us, it continues to be word of mouth, lots of promotion. That video that you saw is posted on our benefit website. We've got lots of other types of materials promoting our things. But again, I still go back to the testimonials. The two cases I was thinking about today that we talked about, just really quickly. One was a woman misdiagnosed with epilepsy. She's going to be shouting it from the rooftops. I mean, what a difference in her life that she found out that, no, she doesn't have epilepsy, and all of the extra burdens that are going to go on with that. Another one of the cases was where a podiatrist wanted to do 6 or 8 foot surgeries on an 8-year-old child. That we got that pulled, or Grand Rounds got that pulled back. So you get, nothing's more fierce than, the mama bear out there saying, look what they did for my kid. So those kinds of things just, they grow. We've seen our utilization ramp up every single month. And so it is we call them campfire stories, word of mouth, that people, I joke about the fact that our employees are more than willing to tell you share all their personal information with anybody that wants to listen. And I like to remind them that they have a right to privacy, and I really wish they would exercise it. So they can't help themselves but share the good news. And they share bad news as well, but this is a good news story.
All right, great. Thank you, Donna. Unfortunately, we're out of time. I'd like to thank everyone for joining today's webcast on redefining employee healthcare, and I hope that everyone found this session valuable. And, of course, I'd especially like to thank Hassan, Donna, and Dan for taking the time and sharing all their insights and knowledge with us today. Also, a special thank you to Grand Rounds for sponsoring this event. If anyone missed any part of the presentation, you'll be able to listen to a recorded version within 48 hours on the Employee Benefit News site. My name's Elliot Cass, and on behalf of Employee Benefit News and Grand Rounds, thanks for being here with us, and have a great afternoon.